Hi guys, I'm Amelia and I'm going to be presenting on gas gangrene, and this disease is commonly known as clostridial myonecrosis. So just an overview of the disease, gas gangrene is typically caused by the bacteria Clostridium perfringens, and it will result in severe tissue damage and potentially death. So just a little disclaimer, gas gangrene can be really gory and graphic. I've left out most of those pictures, but if anyone's interested, you can totally Google it. It's super easy to find pictures of that. So the infectious agent, gas gangrene is most commonly caused by Clostridium perfringens, but it can also be caused by group A Streptococcus, Staphylococcus aureus, and Vibrio vulnificus. But we're just going to focus on Clostridium perfringens. So this bacteria is present in nearly all types of soil and in the gut of almost every animal, and it's associated with decay in organic matter. And it's going to be gram-positive, rod-shaped, and then spore-forming and an obligate anaerobe. And these two things are really important to the pathogenesis of the bacteria. So you guys can look over the taxonomy. I'm just going to talk about the family, which is Clostridiaceae. A lot of bacteria are being moved out of this family just because more advanced technology is teaching us more about the bacteria. So it's kind of being debated right now. Just interesting fact. And then the species, Clostridiae perfringens, this bacteria is classified into different strains based on the toxins that the strains produce. So there's 5 different strains, and the picture shows exactly which toxins each produces. Type A strains are the type that cause gas gangrene, and they can also cause food poisoning. And then type C strains can cause necrotizing enteritis, which involves swelling and death of GI tissue. So there's basically 3 conditions that have to be present for the disease to develop. So condition 1, the bacteria has to come in contact with soft tissue. And this will typically happen through like a traumatic wound, like a kick to the head by a horse. That'll come up later. Or a lot of war wounds where there's shrapnel or like soil that comes into contact with the wound. That type of thing. And then condition 2, the blood supply to the area has to be impaired. And that has to do with the fact that the bacteria is anaerobic. So the blood carries the oxygen. So if there's no oxygen really coming into contact with the wound, that's like an ideal condition for the bacteria to spread. And supporting that is kind of like the fact that 90% of contaminated wounds will have clostridial organisms, but fewer than 2% will develop gas gangrene. So the third condition is that the ability of phagocytes to induce inflammation is repressed due to damage. So basically, if all these 3 things are present, then gas gangrene will develop. So as far as more specifics of pathogenesis, all strains of Clostridium perfringens will produce alpha toxin, but the type A strains produce it in especially high levels. And the alpha toxin acts by damaging phospholipids. So therefore it can damage cell membranes and then cause cell lysis. And the toxin can also activate the arachidonic acid pathway, which is really important with inflammation because it produces prostaglandins, thromboxanes, and leukotrienes. And these, the most important of these is thromboxanes, which cause platelets in the blood to cluster together, and that results in the blockage of blood vessels. So as we talked about, that's really important because if there's no blood coming in, no oxygenated blood, no oxygen, the bacteria can't really flourish. The bacteria can really flourish. So the immune response, part of the reason that the bacteria spreads so rapidly is that there is basically no immune response. The alpha toxin will prevent the innate immune system from producing granulocytes. So neutrophils are prevented from surrounding the site of challenge, and instead they're going to cluster along the walls of the blood vessels. And that's part of the body's first line of defense. So it's pretty significant that that is just not occurring. And then there's also another toxin that that is produced by the bacteria, and that's the theta toxin, which is also known as parafringolysine O. And this causes cell death, basically, of neutrophils, eosinophils, basophils, and macrophages. And then this diagram or chart, whatever, on the slide kind of shows how the immune response progresses. So the symptoms, the skin begins looking normal, and then it becomes pale, and then gray, and then purplish red. And you can kind of see that purplish red in the diagram. Another symptom is subcutaneous emphysema, which is gas present under the skin, and that can cause like a bubbly look to the skin. And additionally, if you like press on the wound, you'll be able to hear like crackling, which is literally the gas moving around under the skin. And then there's also fever, swelling, blisters, like severe pain, foul smelling discharge that's typically going to be like yellowish, thin, shiny skin. And then also it's a really rapid progression of the disease. So this picture shows a 7-year-old girl who was kicked in the face by a horse. And she like went to the hospital, got it stitched up, came back 3 days later because it had like hardened. Her eyelids, both of her eyelids were swelling. There was a yellowish discharge that was secreted. And so she was diagnosed with gas gangrene. It's important to note that it's not common to get gas gangrene in like the orbit area, like she has it right here. It typically will develop on the limbs or like the hands and the feet. So there's a lot of complications of gas gangrene: severe sepsis, shock, encephalopathy, acute respiratory distress syndrome, coma, delirium, disfiguring or disabling permanent tissue damage, jaundice, and kidney failure. And that's just, a lot of that is due just to the fact that the bacteria is spreading throughout the body, and it's kind of just like killing everything, all the cells. So as far as diagnosis, it's going to be based on history, like have you had a traumatic wound recently? And then also the symptoms, and then tests. So you can test for the presence of the bacteria through like tissue or fluid cultures, gram stains. And then to actually detect the presence of the gas underneath the skin, you can do x-rays, CAT scans, or MRIs. And this picture is the same 7-year-old girl, and you can see where the little arrows are pointing in the picture. That's like the gas bubbles that are present under the skin. So treatment, the basic treatment is broad spectrum antibiotics and penicillin, and then also surgery to remove all the dead tissue and any debris that might have been left over from the wound. Obviously, nothing should be left over, but in case there is. And then flush the wound with saline during that surgery, and then hyperbaric oxygen therapy. So this therapy is actually kind of disputed, but it's becoming pretty commonly used. And it basically stops the production of the alpha toxin. It helps the antibiotic to function, and it induces vasoconstriction therapy, which reduces swelling. It has a lot of complications. One of them is barotraumatic pressure trauma, which is basically like damage to your ear, and it can like result in partial or like complete deafness. This picture shows the same 7-year-old girl that we've kind of been following, and she's getting her treatment. But she experienced a lot of side effects. She had agitation and anxiety, nausea and vomiting. So they described her as being like uncontrollably distressed. So they discontinued those treatments after 12 sessions. I think it was like 2 or 3 per day. But it still had, it was beneficial as far as recovery. And then more long-term recovery and treatment is going to include advanced tissue regeneration, because like if you're cleaning out all the tissue that's been damaged, that can be a lot of tissue. And then also plastic skin therapies, like plastic skin grafting, and physical therapy. So in the United States, about 1,000 cases of gas gangrene occur per year. And if the infection if the infection is caught early on and treated immediately, you have about a 20 to 30, or sometimes they'll say 40% mortality rate. And then if untreated, it's 100% fatal. And there's no published data on the prevalence and incidence worldwide, but it's kind of assumed that it's higher in less developed countries just because they have less access to healthcare and antibiotics. So the at-risk populations, so like I mentioned, it normally develops in response to a wound. So that could be a surgical wound or a traumatic wound. If it were to develop spontaneously, it would pretty much only be in someone that has either diabetes, colon cancer, or some kind of disease of the arteries. So gas gangrene was really important historically during World War I and World War II. In World War I, about 10 to 12% of deaths from wounds were caused by gas gangrene. And then in World War II, about 0.3 to 12.5% of wound-related deaths were caused by gas gangrene. And we can see that this number dropped during the Vietnam War. And that was just due to like increased awareness of the disease, new antibiotics, and improved monitoring. So as far as prevention, with war wounds, it's really important to just leave them open actually for, like, they recommend 4 to 7 days, just because if you're suturing over dead tissue, that's going to be the ideal environment for the bacteria to thrive. There's currently no vaccine, but there are studies being done to develop one. And one of those involved injecting mice with the carboxy terminal domain of the alpha toxin. And basically what that resulted in was that the mice produced antibodies that were capable of kind of like minimizing the cytotoxic activity of the alpha toxin. And symptomatically, foot blackening was like almost completely eliminated in these mice. And then the gas gangrene was almost, the swelling that occurred was almost totally gone within 18 hours. So it's not like a total vaccine, but it did improve symptoms. And here's my references. Thanks for watching.